starting with my special friend, Dr. Mudher Al KhairAllah, that we are inspired by. Dr. Mudher is a consultant and honorary lecturer of disability and internal medicine in Tayside in Scotland. He is a clinical lead for Perth Royal Infirmary. He's also works for the Iraq Southern, he's a regional advisor for the RCPE. He's international chair of examiners and heart examiner of the MRCP UK PACES. He's the CEO of the Heart Lung Disease Institute in Iraq. If you haven't visited that center, you need to visit. It's an inspirational and amazing center that he established. He's also a training program director for an Iraqi Respiratory Board in Nasiriyah Teaching Hospital. And nevertheless, he is the chief of medicine at Al Ain Iraqi Medical College. So big applause to one of them. Also with me is Mrs. Hawra Meelani. She is a cybersecurity professional specializing in digital equity, and she's under responsible use of emerging technologies. Her research addresses security risks and biases in AI systems, advocating inclusive design to protect vulnerable communities. And she just shared with us earlier that she tried to study the AI impact of relation to autistic children who are really vulnerable. So she holds a BSc in computer science. She's got a postgraduate certificate in computer science as well, and MA in computing education. And she's currently completing her MSc in information security at Royal Holloway. So big welcome into the system. And we got Dr. Hasan Shahrestani. He's qualified GP with a degree in sports medicine, who has held senior national clinical positions over the last 10 years, including serving as a national clinical lead for GP services at Nuffield Health. And later he as a national clinical director for primary care at Bupa. He was also a board member on the London Cancer Board for 5 years. Dr. Hasan is also an experienced NHS appraiser, a teacher at Imperial College School of Medicine with passion for coaching and mentoring, holding the role of an EMCC coach practitioner. He works with professionals from various fields, including NHS directors, WHO country leaders, health tech startups, and managers across different sectors. His other interests including preventative health, particularly in areas impacting mental well-being, and exploring the potential for artificial intelligence in healthcare, as well as the development of innovative healthcare delivery models. So welcome, Hasan. Grand. So as we start, I would like to take you through the first video that has been generated by AI, but there is no voice coming from. Can we get the voice for this video as well, please? No audio. Sound. So it's a kind of mute video. I'm sorry about that, but with the hope that it's going to work. Okay, so this is about AI and talking about some struggles and challenges that faced by professionals in Iraq in trying to practice healthcare with using digitalization as well as AI. However, saying that we know there are some challenges everywhere in the world, but the future sounds promising. Especially we have the young generations who are very enthusiastic about the applications, using of digitalizations, and yeah, and those were all are Iraqi doctors actually. Who are practicing in Iraq, and they are amazing doctors with very bright brains. And Mudher keep telling me about the treasure that he always discover among the Iraqi professionals and the skills he keeps learning. So yeah, so from there I will start my first question to Mudher then. How would you describe the digital health infrastructure in Iraq today?
Assalamu alaikum. absolutely privileged to be invited, and thank you kindly for the sponsors and thank kind of Embassy Karab and the Iraqi government for setting up this brilliant seminar. بالحقيقة ترى هاي مو كلش حضرت سلايدات وهاي. I'd rather have it as an interactive session. And I could تجارب هواية, and there's many opportunities to share some of the digital infrastructure, how we're trying to build it in Iraq. قسم منها specifically to the state-funded institutions within Iraq. قسم منها ad hoc pockets of excellence بالحقيقة pockets موجودة بالعراق حاليا. راح أكون كلش بريف, راح أعطي وبعدين إن شاء الله نصير opportunities my colleagues sharing their thoughts, دكتور حسين him sharing his thoughts, وبعدين هذا البانل عندهم نزل وجبة إحنا I'd be more than delighted to share some of the experiences that I've had. In short, how would I describe digital health infrastructure in Iraq today? النقطة الأولى, fragmented, truly fragmented, but emerging. وأنا حتى أكون واضح, and I'm not just saying it to be positive. الحمد لله, I am a positive person. بس بالحقيقة, going back, والله يذكره بالخير محمد علوان, who can't be with us today because he didn't get a visa. وأتوقع حتى لو حصل فيزا هم المشاكل قاعدة تصير ما تطيق يضير خطية. محمد علوان, I started this journey with him لأن أنا جيت بالبريطانيا كلش متعود على electronic patient records and the value of electronic patient records هذا AI وغيرها. وكان عندي 3 choices, واحد programmer بجرماني, واحدة programmer بلبنان, وواحد programmer محمد علوان الله يذكره بالخير ببغداد. And I did like a pilot test with the 3 of them. By far محمد علوان surpassed them. التالنتس والتريجر اللي موجود عندنا بالعراق فظيع. وأنا ليش اختاريت هذا؟ كان أكو ريدي مودلز راح يكتب كم هواية من الأخوة الموجودين in established institutions, الكفيل وبوارث, where you can't get templates that are already there حتى you implement them and they're excellent. بس هذا اللي تفت شيء bespoke. فبدينا من الصفر, حتى أتذكر لها تسل الليالي والسهرات اللي كنا احنا بالفندق. هسه محمد علوان أعطيه وداد سلايدات هواية, بس I won't have time to show them. صار هسه تقريبا 22 مستشفى يطبق بها النظام. It includes everything from the word go لحد ما يطلع المريض باركودد حتى يحافظ على confidentiality مالته. ما راح أعطي الموضوع حقه بالحقيقة because it is a whole lecture to demonstrate what is actually feasible in Iraq, but it's something that is absolutely brilliant. وبالحقيقة I would argue some of the electronic patient records اللي موجودة عندي هناك هسه حاليا باسكتلندا, they're not as good as the work that I have in Nasriya, which is really ironic. It's fragmented but emerging. I think it would be emerging a little bit better إذا صار لي amalgamation حقيقي بين state-funded institutions و private healthcare. عندنا limited pockets and tertiary centers و pilot projects, ما راح أضرب تفاصيلها بس موجودة في العراق. من ضمنها projects مالتي, من ضمنها projects موجودة في العتبات, and some other projects موجودة, and they are also excellent and not only providing healthcare service provision بس medical education, e-portfolios و database for research. بدأ هذا الموضوع يتطور بالعراق. Next point in terms of what I think digital, أنه عندنا connectivity challenges, not necessarily بالإنترنت, but these systems are different and they don't talk to each other. زين, what are being time frame of timeline أنا وده أسوي updated versions that are appropriate. وثالث challenge اللي أنا أشوفه حاليا اللي هو الworkforce الحالي الموجود بالعراق والdigital literacy. عندنا أمية فظيعة من digital health records. مو عندنا أطباء بالذات, خصوصا الجنريشن أنا طبعا صرت جد, فصرت جنريشن أفتكر بعتبر نفسي, بس الشباب دول الأصغر من عند الجنريشن الثاني ما شاء الله عليهم, they're unbelievable to the extent, والعبية إن شاء الله بتحكينا عن cybersecurity. بس أنا حد لو cybersecurity علي لأن أنا شغلي بالNHS سايت آخر العراق من وراء تشتغله. اتحدد because they know بالعراق أكو جنريشن دول أعمارهم بالعشرينات, تونس, الجزائر, المغرب, العراق حاضرين عليهم لاكلس هاكرز عندهم قابليات unbelievable what they can do. apps اللي يسوونها ما شاء الله عليهم, الجيفتس موجودة. فالورد فورس والديجيتال ليترسي, دكتور سليمان دخيل ما راح يمانع أقولها, أكبر مني بسنة. أنا كنت مأيس أنه هو يستخدم electronic patient record أول ما بديت المؤسسة بالناصرية, وهسه سليمان without it he can't work. أنا قلت إذا سليمان كان anyone can. وعندنا policy vacuum اللي راح نحكي عنه شوية, اللي هو كلش مهم يصير مستقبلا على مود نحافظ على الديجيتال السيستم confidentiality مال patient etc etc. آسف على الإطالة, but this is a summary of what I think where we are with digital.
دكتور مضر ذكر لنا على مهندس محمد علوان اللي كنا نتمنى انه يكون ويانا اليوم. احنا تواصلنا معه، عنده برنامج اسمه همسه، فزين لا تذكر لنا شويه من مواصفات البرنامج.
فحمزه سريد الذكاء كساعة هو حمزه سماه، وحتى سوى له اكرونيمز هي عركه كانت على ما احنا سوينا على هاي الاكرونيم، بس اتذكرها هوسبيتال فور شي ميديكال سيستم. بس بالحقيقه از جرون ارمز اند ليجز. بدينا الحين حتى البرنامج مو بس مرتبط باللكتشر بيشنت ريكورد، حتى المريض من يدخل ويسجل اكو ترافيك لايت سيستم، سجلت سويت النيرسينج تراياج يصير عنده لون معين، شفت الطبيب لون معين، يصير عندك انفستيجيشنز لون معين وبي تايمر يشتغل. يعني هسه المريض مالتي من يروح التيرن اراوند تايم 1 ستوب فيزيت ينكتب له بالشاشه يشوف 45 دقيقه على ما تحاليله دخله، 15 دقيقه حتى يعرف يروح ويرجع. صار جرين ارجع للطبيب مالتك، صار بنفسجي انغلق روح جيبه من الصيدليه. I don't have this anywhere else in the world. هاي انا ومحمد سويناه from scratch، وهسه هو مطبقه. database عندنا فظيع بحيث within 3 seconds بس خلي اقول انا مثلا eosinophilic endotype asthma اللي هو نوع من انواع التصيبات الربوي، راسا يعطيني الشك وريكورد دخل عندنا بالمؤسسه على مود احنا نسوي البحوث الرصينه حتى تجيب واقع شنو الطب اللي موجود وشنو اللي يتطلب حتى نسوي موديفيكيشن للمريض العراقي. حتى لو عندنا جايد لاينز انترناشونال بس ضروري نعرف الاندوتايب والجينيتك بريدسبوزيشن مال المريض العراقي نفسه حتى نطبقها على الواقع. هذا مثل ما قلت يعني انا ما اقدر اطول بها كلش. هو البرنامج بها اكاونتنج سيستم، الاطباء من يدخلون الكادر التمريضي حتى السالاريز مالتهم اخر شيء تطلع، حتى رواتبهم تكون هي كامله بنهايه الشهر خلال اسبوع وين تروح. سيستم ما شاء الله على محمد علوان، سيستم فظيع. سويت له الواتساب مالتي سلايدات بس مستنين يعني يراد الاربع ساعات راح يتصفيها، بس استشيم انه هو ما اجى اليوم. وان شاء الله في المره يراد له هو يعني if we were to do it I would say اذا من digital health system يراد ورك شوب كامل يوم كامل ويا ناس خيرين وذ الدوله اللي هو مو شرط medical professional but we really need for this kind of thing. ومحمد علوان ملكة هاسل فيزا.
زين ممكن تذكر لنا يعني هسه انت ذكرتنا من ناحيه تقنيه شلون البرنامج به اشياء انت ما شفت اصلا الا بالنظام عليك الدش. من ناحيه السعر
طبعا هو انا اول حمزه سويناه from scratch انا ومحمد علوان فكان subsidized version. I'm not entirely sure. It depends. It really has a lot of factors. And honestly, I'm not dodging the question. بس مثلا institution that's 240 bedded tertiary center سعره يختلف عن ما انت عندك private institution مايو كلينيك ستايل اللي بي turn around مثلا 50 او 100 مليون يتراوح يعني. بس I suspect يعني هو لازم محمد علوان would answer this question. لازم واحد يعطيني proposal and he would give. But what I will say انه محمد علوان local ويدعمه، ونفس الوقت الشيء الحلو بالبرنامج مالته انه it's really competitive. فيعني اي شيء واحد يجيبه فرص وقت طبعا من الكومبتيتيف. يعني لما نتقارن الديجيتال سيستمز اللي موجوده بالعالم اللي تجي اللي احنا نحطها بالعراق، انا لسه هسه احنا بالمستشفى وحده من المستشفيات تشتغل بها بالناصريه المستشفى التركي نسميه لان شركه تركيه بنتها. فهسه اجت شركه قطريه وجابت لنا سيستم متكامل منطبقينه بقطر. But to be honest, I can only utilize about 60% 50% of it. هاي غير الليترسي غير التدريب مالته، لانه ما مصنوع خاص بالعراق. احنا يجونا كل شويه من برايفت سيكتور يدخلون بالحكومي، يعني يرادها في شيء خاص بي يعني. والاخوه والزملاء اللي يشتغلون مستشفى الكفيل وبارت والهاي اللي يطلعون من العتبات مثلا، انا متاكد عندهم نفس الاكسبيرينس موضوع شركات اللي تجيب لنا الريدي ميد بروجرام شلون تطبقها على ارض الواقع.
استاذ دكتور حقيقه مساله على السعر عندي مغزى من هذا السؤال. البرامج الاخرى اللي احنا نستعملها نشتريهن يعني من الشركات نشتريهن بملايين الدولارات ملايين عليهم، بينما برنامج اللي يسويه اخونا محمد علوان ما اقدر اسوي له دعايه شخصيه لان ما عندي مصلحه وياه، بس من خلال حديثي وياه الاسعار اللي يقدمها ما ابدا ماكو مقارنه كذي، والخصائص اللي يقدمها والفيتشرز اللي يعطيك اياها وكذا هذه كلش اكثر من البرامج الاخرى الموجوده عندنا. فعندنا طاقات موجوده بالبرد بامكانها انه تنتج نتاج عالمي very competitive at very competitive prices as well. فمهم جدا انه احنا نهتم او نكتشف الموجود بالعراق من
هاي محمد هذا البرنامج اللي سويناه نحكي عنه هذا بالناصريه كان 2016 كان شو اسمه حطيناه ب 2016 لحد هسه مرتين صار عندي جلتش بالنظام بس مرتين. انا كل اسبوع مره بارتراين في امريكا انا بس مرتين صار عندي جلتش.
طيب زين. رح نتحدث الآن عن التشالنجز الموجودة بالعراق، فأنا أخذ رأيكم بالموضوع. فإذا ممكن كل واحد يطلع تليفونه يكون مربوط بالإنترنت، إذا عندكم إنترنت دايركتلي، إذا ما عندكم الواي فاي سكان الكيو ار كود. إذا ما تقدر تسوي سكان الكيو ار كود تدخل على الويب ادرس مالتك، تكتب slido.com وتدخل هذا الرقم. برأيكم what are the key challenges facing the implementation of digital health in Iraq?
Sí.
Okay, you can specify English. So we got 59 responses so far. I think what is coming up, you can see it on the screen, started initially no electricity, but start fading afterwards. So mainly digital illiteracy, infrastructure corruption, lack of knowledge by the public, and the cultural resistance perhaps. Poor infrastructure is coming again, and training. But the rest of other factors could be, realistic, and like unstable Wi-Fi, for example. That's a big challenge. Priority of the healthcare providers, mentality that goes under, perhaps the resistance. Yeah, lots of interesting answers. So thank you very much for your interaction with us. That's really useful. So from there we go to we'd like to know how could starting with Hasan now. Let's ask Hasan. Let's, if you don't mind, share with us your experience. I believe that you use AI in your healthcare services, so please share with us your experience.
Thank you very much. Thank you for the introduction, Dr. Hussain. I think we all agree Muhammad Alwan is an inspiring person we'd all love to meet. I think looking at the benefits of AI, and a lot of you will probably have used AI in your practice. What AI does, it's very good at recognizing patterns. It's very good at giving you a second opinion. Most doctors are afraid of AI. AI is not the Terminator machine that we believe it may be. I mean, if we have a show of our hands, how many people here use ChatGPT on a weekly basis? Okay, someone was just saying, Dr. Mudher is saying that the paid version is next level. How many of you use ChatGPT for medical purposes? Interesting. Okay, lovely. I think one thing I want to point out is that there are two differences, especially in medicine. Think of unregulated AI and regulated AI. So when you use ChatGPT, that is unregulated AI. We know a lot of doctors, a lot of students in hospital are asking ChatGPT, what's the diagnosis? What should I do? Now, the problem with ChatGPT, it can hallucinate, it can make up information. But what's increasingly happened is that certain pages are blocking ChatGPT. So what tends to happen is ChatGPT will work on scanning millions of internet pages and then come up with a pattern recognition. So the word dog, the next one will be puppy. Now, if NICE guidelines and a lot of them block ChatGPT, just be very careful. The other problem, especially with using AI, is that it's very bad at picking up the nuances. So You know, the doctor is the one that knows the patient best, so AI will increase those health inequalities. Having said that, I do use AI, and we do use AI, but only regulated AI. Who's heard of Heidi AI? Okay, it's quite a few people. I think one thing to take away from today, please go and look up Heidi AI. It's just won the NHS contract. It will revolutionize your clinic. So how we use Heidi AI is in the consultation, it merges with the computer system, you switch it on, and it records the consultation. And then what it does is it gives you a transcript of the consultation in a medical way. So it gives you the history, the diagnosis, the examination findings. And how I use Heidi AI is I copy and paste what I want. You've got to talk to it. So you've got to say respiratory rate, you know, I don't know, 16, SATs 98, and it will record it. And the patient consents. So in a GP consultation where you've got 10 minutes, it saves me about 3 minutes typing. Consultants are using it for letters. Now, AI has been around for ages, and how it can make health inequalities more sort of pronounced is Babylon was the first company to use AI in triage over 15 years ago. Do you remember the famous case where AI works on patterns? So there's a 50-year-old female that used AI Babylon and said, I've got chest pain, and the diagnosis were more likely to be acid reflux. So what AI does is, because she's female, it had learned that females are less likely to get heart attacks. Guess what? She had a heart attack, and it was a massive litigation case. So I will urge you to think about how you use AI. You need your NHS trust to push it through. The other AI that we use is PM Cardio is amazing. Literally, it's on the phone. You scan an ECG, it gives you the diagnosis because it's seen millions and millions of ECGs. Where NHS is really employing AI is in pattern recognition. So one of the hospitals up in North uses AI on a monthly basis to filter all their datexes, all their complaints, incidents, and look at repeated patterns. So that's one of the best ways to use AI. Now, hopefully, with what Dr. has shown us here on this platform, it can integrate these different AIs that will help you in making better decisions. So AI can sit in the background, look at the blood test results and look at the trending and say, you know what, this patient's at risk of bowel cancer. We're noticing their HB drop. AI is a very interesting tool to use, and I guess it's about using it where to fill the gaps. So it's not a replacement for decision making, but it's a second opinion, and that's where it works best. And we know that in Iraq, one of the things that we really struggle with is lack of radiologists, lack of oncologists and pathologists. In the UK, very soon, mammography will become very easy reported. At the moment, we've got a 10-day waiting time for it to be reported. And imagine you've got a lady sitting there with breast cancer. So what AI is doing is they're actually going to use AI to do the first report on the mammogram and then be confirmed by a consultant radiologist. So AI is still at the place where it needs proofreading, but it can filter a lot of the normals. And again, in lung cancer, there are massive trials where for screening CTs, it's proven to be actually amazing, where it's picking up nodules much better. Having said that, AI can hallucinate. So remember, I told you, unfortunately, there are instances where on a chest X-ray, it will see the female breast and say, actually, that's a shadow, that's cancer. So it needs proofreading. The other place where AI, unfortunately, has beaten some of the dermatologists is picking up melanomas. So that's shown, the research has shown that it's very good at picking that up. And that's been used in the NHS for ages, where you take a screenshot of the lesion and you send it off and it gets read remotely.
Thank you very much. And it's very important to talk about ChatGPT and to know whether it's regulated or unregulated. Let me share with you my experience. I've developed my customized GPT called Safario. My surname is Saffar, and Safario like Super Mario. So he's being trained in pediatric endocrinology. So I fed the information where I wanted the answers to come from. So the answer coming only from what I fed. So I uploaded some textbooks, some guidelines, and so on. And then the answers coming only from what I fed. I did a training for this customized GPT, like between 10 to 15 questions every day for about a month to make the answers coming quickly, thoroughly. And guess what? Afterwards, start uploading the endocrine dynamic function tests. So perhaps you know that, like Synactin test, I need to take maintenance sample after 30 minutes, after 60 minutes, another samples, and so on. With the rapid turnover of my juniors who come in training with me, so basically I uploaded all the different dynamic function tests, and then I showed the juniors when they come into rotation, if you want to request to order endocrine dynamic function test, to tell this tool to say, I've got a 5-year-old child, the weight is 25 kilograms, coming for short stature investigations, provide me with the investigation that I need to do. So we'll say, for example, I need to do growth hormone stimulation test, glucagon stimulation test. This is the dose based on the gender or the weight that you're given, and these are the timings. So you can use it, very simple and easy. And I'm happy in the coffee break to show you how to customize GPT. Very simple and very easy. So that keep this in mind, and then we'll talk in the break about it. Okay, so now let's move to this. In the WhatsApp group created by the Iraqi Medical Congress, there is a group for digital health. So I put a question on. I said, what kind of digital health startup do you think would succeed most in Iraq? And perhaps some of you answer this, because this is coming from the delegates of this conference. Majority said it's health education and awareness applications. Second was for remote consultation platforms. Then medication delivery services, and only one talked about AI-based diagnostics and triage. So from here, I will move to Alwiya Hawra to talk us about the AI diagnostics.
Thank you. Our wonderful panelists already shared how they're utilizing it, and I'd like to give a little bit of an addition to that. So we know that it's being used by radiologists. We know that it's being used to diagnose situations that may arise that are quite complex, right? What I'm kind of thinking about, what I'm worried about, especially when it comes to Iraq, is in addition to health inequalities, that some services are not available in rural areas. So this is an advantage if they've got a mobile phone that has a camera, right? It's enough for us to have AI-powered apps. Again, keeping in mind the hallucinations, keeping in mind the issues that arise. So this does provide them with an opportunity to have access to healthcare a little bit faster than they would in the normal sense. However, on the other hand, we need to kind of really focus on the topic of AI bias, right? So our wonderful Dr. Hasan here mentioned that it does work, AI does work on the information that you're feeding it. And so my worry here is that if we're utilizing applications that are created based on Western standards, right, or different ailments and issues that happen in the West, how useful are they in implementing in Iraq? So it's really important for us to focus on utilizing localized data, using the same people who are going to be using these apps to feed the data and improve it. So that's kind of where my thoughts are at right now. And then the other issue, inshallah, we'll bring up as well later on is the topic of data privacy and cybersecurity issues in AI apps.
Thank you very much. We'll keep passing the microphone. Another use of ChatGPT that we found it very useful is uploading all the policies and guidelines that you have from your institution to be just specialized. So if you've got someone coming to emergency, for example, and he's from, say, for example, well, I'm talking in Oman, where the people who are not local people, they have to pay for the services. So a patient coming to emergency department with certain diagnosis, say, for example, acute appendicitis, really needing urgent surgery. Would they pay or would they not pay in the first 24 hours? So the A&E physician wasn't sure about it. And so he has to find out by going through the policies and so on. That's time consuming. But if you have this customized GPT where you put all the policies in and you just put the scenario that you are facing, it will extract the data that you want from your own policy and will give you an answer eminently. So that's one of the uses of the AI. Now, let me ask you again, if you just go back on your phones, how ready do you think the Iraqi clinicians and healthcare professionals to adopt digital tools? So 1 is not ready, 5 extremely ready. Answers keep coming. Okay, so we've got 55 responses so far, and majority, about 40% of the audience, thinking that the clinicians are in middle. Okay, as you can see here on the graph, scoring 2.7 out of 5, and their readiness of this liquor skin. Dr. Mudher wants to have a comment.
Yeah, I agree with that. I think it's natural that it's in the middle. And لو واحد سألني هسه over the past 20 years, I would say in the private sector 4 or 5, or not non-government institutions. In the state funded definitely 1, يعني definitely إذا مو أقل 1.5. I think there's a lot of appetite to adopt digital technology. 1. 2. I think personal opinion أنه بالعراق, from my experience, it's a little bit different from the UK and Western culture. بالUK احنا we have a standard معين or aspiring to a particular standard that we have to meet 80-90% before we implement something on the ground, which is of course it's got its benefits. أنت تحمل مريض at the end of the day. But in my experience, that just stagnates. It's not attractive in Iran, and it doesn't always work. The things that I have been successful in implementing is that you put them into the deep water, yalla isbah. So you put something in, you sell it to them because they see how attractive it is. وبعدين retrospectively, I'm not going to talk about the ethics of this, but retrospectively, it's helpful because you get into a pattern اللي هو خاص بالعراق, how you start addressing health inequity مثلا. مثلا احنا عندنا العلمية قالت ساعة, بس أنا مثلا بس from my experience اللي حتى اللي يروحون للغلاف وأطراف المحافظة الذيقار, they always have somebody with them with a smartphone. فتجي الحجية مثلا, she might not be able to use it, بس الفولو ابوينتمنت مثلا قلها خالة هذا رجعي لي, قالت ما بيها انا ارجع لك, ياها ببياج, ابنها very easy, بتها, you can't communicate with them. And I think the people that are working in Iraq on the ground, they relate to this, that we shouldn't underestimate what they can do with smart technology. I think it's promising. I just think it has to be cleverly implemented in Iraq. We shouldn't just be copy-paste Western culture of how we can implement digital technology.
Completely agree with this. Right, so back to Hawra, if you tell us what are the cybersecurity threats?
So we have all sorts of cybersecurity issues when it comes to healthcare. I'm going to focus on 4 points for us to take up. Firstly, when it comes to cyber attacks, so one of the biggest issues within cybersecurity is the issue of hacking, right? Dr. Mudher very wonderfully put that we have brilliant programmers in Iraq, a lot of them programmers who then move on to hacking because it's, it knows that it's financially, it gets them financially well. Why can't we utilize the services of these wonderful individuals and utilize them for the good, right? So teach them cybersecurity skills, which then takes us to training and cybersecurity awareness. But cyber attacks are the biggest issue in healthcare because data can be sold on the dark web. Now, when it comes to financial data, for example, credit cards, email addresses, these get sold for $1.5 per data point when it comes to the dark web. When it comes to healthcare information, they're selling it for around $250, $300. The reason being, when it comes to your financial data, it's a credit card. You can change the credit card number. You can change those details. When it comes to healthcare, this information is, firstly, it's historical and it's very, very personal. There's nothing that's going to be changing about it, right? And then that then can be utilized for fraud and all sorts of issues, or even ransomware. So that's the first issue that we need to kind of worry about, cyber attacks, data being sold on the dark web, and it's happened previously to the Iraqi government by hackers in Iraq. So they have these wonderful skills. Why not utilize them for positivity and for good? The second one is Iraq's threat landscape. As we digitize the healthcare system, it does make it a lot vulnerable. And so what kind of security, there's a concept called security by design. When we're creating these healthcare systems, are we building them with security in mind, or is security a secondary thing that we're thinking about? And it's like, okay, because it's going to cost me a couple £100,000 or a couple $100,000 to build a solid cybersecurity infrastructure, I'm not going to spend that money right now. But when you are then attacked and you're held, ransomed by ransomware, you're then paid, for example, the NHS when they paid £92 million many years ago with the WannaCry attack, or United Healthcare in the US, they ended up paying $220 million to the attackers just to get the data back. So these are all things that are really, really important to kind of consider and think about. The third being patient safety. All this operational technology, all these devices that are connected to technology, to the internet, these, if we're not thinking about the security of these devices, they can easily be hacked. And so does that not put us at, we've watched movies previously where when they want to get rid of someone and they hack their car, the car, or they hack the smart home easily to hurt someone. What are we thinking about when it comes to medical devices? We're giving access, the moment it's connected to the internet, we're giving access to someone, to this patient, access to the patient, right? And fourth, this one is really important. You raised that earlier on about the UAE giving everyone, there was a statement a while ago, UAE giving everyone, every multinational, access to ChatGPT Plus. Now, the worry about that, data is a national treasure. Data is the currency. And so as a country, when I'm allowing people to have access to ChatGPT freely and are paying for it, what kind of access am I giving companies like OpenAI and many other data companies, right? What kind of access am I giving them to the entire nation? The way they're thinking, their psychology, their ailments, their health issues, their marital problems, right? So we're giving access to national treasure, which is data. So these are all four very, very important concepts to consider when it comes to digitizing the healthcare system. I'd love for us to, discuss that, inshallah.
You're absolutely right, Sister Hawra. I just wanted to comment that that's such a valuable lesson. So I don't know if you guys remember, probably about 6-8 months ago, but King's College Hospital had a hack and you couldn't order any bloods, all the patients were being sent to A&E. The other thing that you've got to be careful is if you listen to what's happening, people are saying AI are going to take over our jobs. One of the things that Heidi AI does is it listens to your consultation, and it's only £50 a month, very cheap. Now, what they're really doing is they're not interested in the transcript. They're interested in what the patient says and what's the next question the doctor asks. That's what they're learning. Because imagine that they'll put that in front of the patient and that we know what the questions are. So what you upload onto ChatGPT, be very careful. I think especially in the UK, if you're uploading anything related to your NHS policies or anything, you've got to be very careful. So a lot of trusts have blocked ChatGPT. Having said that, Microsoft Copilot is a bit better. It's got more stringent security rules. And in our area, we use it. So a lot of the leadership team will use Copilot. At the end of the day, it integrates with Outlook, and I'll ask it, I got 100 emails today. What have I missed? What are the theories? And it works amazing.
Thank you very much. So let's move to another part of using the digital health now. Dr. Mudher, can you tell us what are the biggest legal and ethical challenges in digital health in Iraq? And can you shed the light, for example, God forbidden, there be cybersecurity attack against, the data that you have in your center? Who will be liable? Is it you or Mohammed Alwan?
أشتيتك هو بالحقيقة I protected this is exactly what they just mentioned by so the system that I use in Nasriya is intranet only, not internet حتى أحميه من هاي المشكلة. But I would love to have access as we sit down here and speak today. بس لحد الآن أنا نخليه intranet because of this risk. هاي وحدة. الشغلة الثانية إنه ترى by the way علوية ترى those people who are talented. The problem is there's a trust issue. They don't trust the government to honor paying them handsomely وبعدين ما يشطون عليهم ويسووا لهم شيء لمستقبلا. What I don't like them. ولا the government trusts them because they're going to get paid by whoever. We're not going to talk a particular country. A lot more handsomely than what they would get paid in the government على اللي يكونوا في البرنامج مع cybersecurity. فهذا الموضوع is that it's just not enough money to go around and there's not enough trust sadly. مع انهم فعلا talented. ما راح احكي وايد هذا الموضوع. data privacy and security هو بالحقيقة cybersecurity issue. informed consent patient autonomy مو بس بالديجيتال اصلا يعني culturally احنا كلش ضعيفين به بالعراق. فهذا اصلا خلينا نعدله culturally من البراكتس مالتنا قبل لا احنا نجيبه بالديجيتال هاي. equity and access باشكال هذا هم another challenge I think ethical بس I think it's better than people expect it to be من ناحيه الكهرباء من ناحيه الاكسس من ناحيه الاكسس to smartphones etc. ما عندك مشكله. professional accountability almost non-existent. هذه شغل كلش هوايه. cross-border data storage بيها مشكلة طبعا because you can get stolen data etc. والethical use of AI. I address it differently. I know that you could be risk averse to using AI مثل ما تفضلت حضرتك بس بنفس الوقت مثلا اضرب لكم مثلا هسه عندنا امتحانات البورد التنافسي بالعراق تمام؟ ايش لقيت انا طلاب البورد شو يسوون؟ يدورون بالاي اي وغاده questions generated بخصوص فلان شيء. ليش؟ لان الاساتذه قاعد يروحون ما بيه حيل وما له خلق يطق بالاي اي give me 5 questions بالانستيتكس give me 5 questions بالريسبيرتري ميديسن. فذول الشياطين طلابنا يروحون يسالونهم اساتذه ايش قاعد يسالونكم والاي اي unfiltered قام يعطيهم هاي الاجوبه. فانا هسه الاساتذه من هيك ماكو مشكله استخدم الاي اي بس من يعطيك السجستشنز انت من يمك غيره اعطاك الفكره شنو مال السؤال اعطاك البست اوف 5 ماش ايتمز بس انت حتى ذول الطلاب ينكبسون بيها غير الصيغه مال السؤال شويه او الاوبشن مال الانسر شويه اصرف من وقتك شويه بس هاي كلها الشغلات I think we will refine it in the future when it becomes a little bit more regulated. What do you block it from? يعني اكو شغلات that you can do. فقصدي هاي الethics موجودة as it is with everything else. You just need to address it in a dynamic fashion بالعراق.
بس كوني مطلع على بعض المسائل بخصوص الديجيتال هيلث بوليسيز بالجي سي سي كونتريز. العراق احنا ترى مو كلش بعيدين. يعني مثلا بالسعودية خلال بس 3 سنوات سابقة بدأوا يشتغلون وطلعوا ديجيتال هيلث بوليسي. عمان السنة الماضية كان شغل ورك شوبس وعلى مستوى وزارة الصحة لحد بعدها ما طلعت. فيعني هذه الدول اللي هي عندهم الانفراستراكشر اقوى لعله بعدهم متاخرين بموضوع الديجيتال هيلث بوليسي هي تكون ريجوليت اول ذيس ايشوز. فاحنا بالعراق يمكن انه اذا نرفع هذه المساله الى اصحاب القرار يعني هون يعني we just bring it to their attention. Hey, work in progress, fantastic, that's really good. So if we have digital health policy in Iraq, this is going to be a good regulator for this. From there, I'll move to no, we covered that. I think Hasan, if you shed the light on what role should government, private sector, and international partners play.
Thank you very much. Dr. Miller, I love what you said, but I don't know if I fully agree with that. I think what AI can do is if it will make those people who want to be lazy even lazier. That's the problem with AI. So what we're finding is that people are losing the ability to critically analyze and think. And I don't doubt that we will get to a time where someone will say, well, the diagnosis was set by AI. What's it to do with me? So that's why you see in the NHS, they're not incorporating it as fast as the private sector. So in Bupa, we opened the Apple clinic in Battersea, and Apple have got all sorts of AI. You know, all their employees, 7,000, wear an Apple Watch. They can predict who's not going to come to work tomorrow. But I think what's really interesting with AI is that, and I'm seeing it in appraisals, in doctors' appraisals, they're using AI to do their reflections. And if you use AI, you know, it says words like additionally, it talks in an Americanized language. And students are smart. So they will upload a paragraph that they're doing, and they'll say to AI, write this paragraph in the way that I do. And academics in Imperial, they're struggling to pick it up. So what they're asking people now is, did you use AI? If so, how so? And what doctors need to do, I think what you mentioned for saying a course on AI is vital. And if you guys want to plan for the future, is to what the LMC and the organizations are saying is doctors need to learn how to challenge AI. It's okay, we all know everyone's using it, but how do you challenge it? And I think a course like that is very important. So the government, the private sector, start to think about where AI is most useful. So in terms of the biggest success in AI, again, I was looking at this, the biggest success has been around chest x-rays and picking up nodules. And we could sit here and theorize this, but ideally doing the pilot, and if anyone has got the capability and wants to work with the team here, even doing a 6-month pilot in one of the hospitals, using AI, doing 5,000 chest x-rays in an area where there is morsel, where there's high TB, there's high smoking, and then after 6 months, see how many cancers have we detected. And you can do it all through AI. You don't need to pay a radiologist. All you need is a mobile X-ray screening unit. There is a lot of government funding, especially for AI projects. So a lot of the youth, mashallah, are really interested in how to use AI. The World Health Organization has got a lot of approved tools that you can use. But really it's finding, and you guys mentioned electricity, low Wi-Fi in certain areas. So finding areas where you use low, cloud, or even you can use offline as well. The private sector, you're right, is very interested in AI because it's a very good way to essentially cost cut, and we're already seeing it being used. But if you use it in the right way, just like when the internet first came out, people were using it for various reasons. If you think about AI, over there you have a second opinion. And as long as you use it as a second opinion and you're aware that you're making the decision, it's one of the best things that they could do.
So let me take you to the last question for today's session. So will you be interested in seeing advancement of digital health in Iraq?
Just quickly, ترى واقع حال ال AI. أنا قناعتي التامة. I know with all the reservations about AI etc. بس إذا واحد ما راح يتعلم AI بالصورة المطلوبة, they would be illiterate within 2 years. 100%. I'm talking health professions, not to mention others. وبعد يعني أنا مساعد ضبط لهم مثال. I was doing a ward round on Monday, Perth Royal Infirmary, و I had a patient with asthma, refractory, وراوتني فيديوز المولد اللي موجود والهاي. أنا بالموجع كملت. As I was typing the border entry on the digital systems, استخدمت ال AI within 5 minutes template من هذا المحترم. Basically, يقول لل Perth and Kitros Council, if you don't rehab this woman, we will kill her. But in a much more tactful way. زين كتبتها بتفاصيله, كملت الوجه, printed it, وديت a copy, سويت template, السكرتيرة عاشت ايدك, I don't have to dictate or type anything, copy paste. طبعا proofread, الحمد لله. وطيتها للمريضة, she got rehoused, she's going to get rehoused on Monday, within 1 week. ايام زمان كان resources عندنا بس اقعد اسبوع اسبوعين على ما تطلع الرسالة وتروح, يجوز ما يترمى. فيعني I'm not saying, يعني I'm saying you can utilize it in positive ways, but you have to be careful.
So I totally agree with you, Dr. Mudher. I think the example you gave is you were doing the thinking, not AI. The risk is that people, will use AI to do the thinking for them. Do you know, it's so interesting. The last hiring manager in the hospital put out a job for a doctor. There was 40 applicants on the CV. Most of them had written the same covering letters. And then she interviewed them. Half of them couldn't speak English. I think it just shows that you will know who's not using AI. But it's the best thing you can do. So there is a very famous saying that says that in the next 2 years, as you mentioned, doctors who use AI will replace doctors who don't. I think that's the message to go away with. And if you, as clinicians, are not thinking or using AI, in your appraisal this year, put a PDP. How does AI influence healthcare? Go and read NHS Digital Lab. It's got the best thing. I read one article that I'm very much aware of how AI is being used in the NHS.
Thank you very much for your amazing enlightenment for us today. So I'll open the floor now for our audience if you have any questions, and yeah, please.
أخي العزيز، أنا الدكتور حامر الصفار، وأنا أشتغل جيرياتريشن ستروك فيزيشن في ويلز. وأعتقد واحد من أهم مهمات IQMC UK هو أن يطلع بتوصيات. يعني إحنا بانل نناقش الصحة الرقمية في العراق، وحضرتك ذكرتوا حضراتكم أن الطبيب في المستشفى الحكومي في العراق إنما يستعمل ال AI يعني 1% دكتور مبر، بينما في المستشفيات الأهلية 4 و5 وأكثر. طيب إذا هذا الرقم دكتور مبر، أنت تشتغل في اسكتلندا، هذا الرقم إذا تذكر الآن للحكومة البريطانية، هذا أنت كريت 2 tier system. أنت كريت نظام حكومي شكل ونظام صحي أهلي شكل، فأنت هنا تأذي المجتمع في النتيجة. فإذا احنا نريد من IQMC UK يطلع بتوصيات للحكومة العراقية. بالغرفة المجاورة دكتور غياث الجويلي مستشار رئيس الوزراء العراقي للAI. فرجاء اخواني الاعزاء نطلع بتوصيات للحكومة العراقية في موضوع رقمنة النظام الصحي العراقي الحكومي قبل الأهلي. شكرا جزيلا.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. الدكتور أحمد الإبراهيمي، راديشن أونكولوجيست، مدير مركز الأورام في مستشفى الكفيل التخصصي، وأيضا مسؤول عن الجودة، شعبة إدارة الجودة في مستشفى الكفيل، تدريسي في جامعة العميد، مسؤول عن الجودة في كلية الطب جامعة العميد. أنتم كنتوا تتكلمون وجاتني مسج. عندي فريق عامل في مستشفى الكفيل من أروع ما يكون، يشتغل في موضوع الجودة، شباب خريجين حديثين. فبعثوا لي announcement وعدوا يبعثوها يعني المستشفى بسرعه فيما يتعلق ببعض الستاندردز اللي في مستشفى الكفيل. فجاء باوع عليها، قلت لهم هذا شات جي بي تي ديزاين. فواحد من الشباب، هو انا شوي عفوا شوي ليزي في كتابه الموضوع، فينطق هنس، فتاكيدا على كلامك انه اكو عندنا ناس ليزي. فبصراحه ضحكت. صار تصادف بالموضوع. الفكره اللي اريد احكيها، لما كنت عرض الكويشن الاول كتبت انا تعليقات انه الفلسفي. انا كطبيب في بعض الاحيان مره قعدت ويا احد الاساتذه في قسم الفلسفه، قلت له الموضوع الفلسفه بصوره عامه ما نقتنع به. قال لي لا، هي الفلسفه القمه 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 لكل شيء. ففعلا بعدين اقتنعت بالموضوع. احنا حاليا الكثير من النقاط من ناحيه الفلسفه ما مؤمنين بها ككوميونتي فيما يتعلق بالانفورميشن تكنولوجي. يعني تكلمنا عن موضوع مثلا البرايفسي، كثير من الناس حتى بالكوميونتي العاديه بالاضافه للاطباء والجهات الصحيه العامله ما مؤمنه بموضوع البرايفسي، حتى انه يقول لك انا البرايفسي وادفع عليه فلوس واصرف وكذا وكذا وكذا. اضرب مثل واختم. المثل اللي اضربه، شايفين الساحه والميدان الركض، اكو نوع من انواع الركض هاي اللي يسلم البريد، اوكي؟ فكانما احنا اللاعب مالتنا اجى بالنص وقام يركض بدون ما يستلم البريد من اللي قبله. المجتمعات تدرجت بالموضوع شويه شويه. فلذلك يعني انصح انه يصير انفستمنت في الكاباسيتي بيلدينج. الكاباسيتي بيلدينج من ناحيه الكوميديا، يعني نستثمر بالبشر اكثر مما نستثمر بالكمبيوتر. هذا الكمبيوتر جاي موجود يعني، لكن نستثمر بالفكر بانه نطوع الناس او يعني نعرف الناس اهميه الموضوع. لان هذا اذا اجى والناس ما مؤمنه به وما تعرف شنو اهميته، حتى راح التراب يجي عليه بصراحه. فالقصد من هذا الموضوع الاستثمار يجب ان يكون بالبشر، انه نوعيهم ونفهمهم شنو اهميه الاي هاي، شنو اهميه يعني الاي تي، شلون راح يحل لنا المشاكل. بصراحه جاي يستخدم حاليا لكن مو الاستخدام الصحيح اللي موضوع له. شكرا جزيلا.
طيب خليك تجاوب السؤال بعدين ارجع. لا أي شكرا جزيلا. انا بس تعليق على الستيت فاندد انستتيوشن. طبعا دكتور عاشت ايدك. انا in all honesty انا من جد من 2003 2015 كلش كان الباشن مالتي هذا وهسه لا. ليش؟ Mainly because I think we've got a point, and I'm not saying this negatively, I'm going to qualify it. We've reached a point where a state-funded institution and healthcare بالعراق is broken beyond repair. أصلاً أنا أتوقع ال NHS as it stands in England, not so much Scotland, is struggling. فتخيل العراق اللي هو $124 US dollars per head per year is what they invest, not accounting for mismanagement, corruption, false employment. وتقريبا the equivalent to this $5,400 US dollars ببريطانيا. فأصلاً يعني you're asking the government to do something that's impossible. What I would suggest moving forward, and the government gives incentives to the private sector to create institutions rather than individualized clinics. وthen the institutions يقولوا لهم they can plan incentive مو شرط financial. There are incentives that you give them and they يسوون partnership حقيقي ويا الحكومي. That way هم ترى أكثرهم ترى أطباء يشتغلون both. صح. فأنت هسه أنا عندي فريق كامل، عندي تويننج سويته بين المؤسسة الحكومية اللي عندي واللي برايفت. فبكل سلاسة أنا أقدر أحول من واحد لواحد لأنه صدق أنت من عندك بارتنرشيب حقيقي. بعد تعتمد على هذا الفريق هو يضمن لك هالشغلات اللي أنت تقدر تطبقها بصورة سلسة أكثر بالبرايفت سيكتور. فالحكومة إذا أرادت I think they would have to partnership with the private sector ويعطونهم الانسنتفز الحقيقية ويحاولون بيساعدونهم بموضوع الريد تيب. I think that would really help address the inequity اللي تفضلت به حضرتك.
كان الإخراج. إذا ممكن أسئلة قصيرة وأجوبة قصيرة.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I'm Dr. Osama, medical oncologist from Al-Mushtaba One Monitor Plant Hospital. For Dr. Hasan, AI will replace doctor. I totally disagree. There is an Indian doctor, I think before 2 weeks, post a video showing an X-ray, chest X-ray, for a patient, and he said, what I learned in 20 years, AI replaced in AI did in 2 seconds. So it's an amazing. Because I'm an oncologist, I'm really interested in the trial between the mammograph especially and the AI, and to show there is 2 trials. I remember the Karma trial. This is more advanced one. Karma trial integrate between the AI image and the pathologist of the same patient. So it is totally amazing that happened in Sweden. In UK here, this MSI trial, also it is the same between the genetic and the mom. So it will replace in here or now or soon after. My question is there because they're digital, is there an tools for AI that are more specialized? You mentioned ChatGPT. There's tools more specialized for specialization, not only AI. What I think in AI, it is now is a solution, but in the future is a problem. This is what I think. Thanks.
Perhaps we're going to have only one last question, Brother Hans.
Hello, I'm going to be speaking in English because it's easier for me. My name is Dr. Hussain Al Saffar. I'm a cardiology registrar and I'm also a research fellow. I'm doing a bit of work in AI myself. And a lot of the talk is focused around ChatGPT, large language models. But of course, AI, there's so many more applications, isn't there? Using clinical data to improve patient selection, improve treatment decisions, understand the prognosis of patients. So there's so much more to than just using it like a search engine and then giving you information for when you're using AI. This is one thing. The other thing I just wanted to say was are we running before we can walk? Because I don't know definitively, but my understanding is the healthcare system in Iraq, do you have electronic health records? Is it seamless, everything joined up? Because that might be the first step. If you even want to use your data and leverage your medical data, you have to have systems that talk to each other and that are seamless. And if you want to improve these workflows, the first thing is to transition to an electronic health record system. And then you can, if you want to train your AI models on data from Iraqis, you want to have local data, it needs to be in a digital format so that AI can understand the data, doesn't it? So you need to have that step first, and then you can develop bespoke models using local data. So that's it.
I would love to have more people to ask the questions, but I'm really sorry because the time constraint there. So we'd like to adjourn this session to allow our colleagues in the next panel to start their talk about the health insurance and the private healthcare system in Iran. Thank you very much for my colleagues here.